COVID-19, a challenging pandemic. Written by Keith and Sarah Quartermartin. Focus question. What is COVID-19 and how can all people help prevent the spread of such illnesses? A new virus. In December 2019, doctors in Wuhan, China, were alarmed by a new illness. Its symptoms included shortness of breath, fever, and fatigue. Some patients had so much trouble breathing that they had to be hospitalized. With good medical care, many patients recovered, but not all survived. This illness was caused by a new coronavirus, and it was named COVID-19. The disease spread rapidly. In March 2020, the World Health Organization, WHO, declared that COVID-19 had become a pandemic, a disease that had quickly spread all over the world. Pandemics like COVID-19 have a huge effect on daily life. It takes effort from all of us to defeat them. From scientists to students, we each play a role in solving pandemic crises. What causes pandemics? Pandemics have occurred since ancient times. For example, the plague of Justinian spread across Europe, Asia, and Africa around 541 CE. This plague killed 30 to 50 million people, about half the world's population at that time. About 800 years later, the Black Death traveled from Asia to Europe, killing 50 million people. Both the plague of Justinian and the Black Death were caused by bacterial infections. Today, drugs called antibiotics kill many disease-causing bacteria, so bacteria cause fewer pandemics. Modern pandemics are more often caused by viruses. Viral pandemics of the past and present. Viruses have caused deadly pandemics many times in history. A viral infection called smallpox circulated around the world for centuries, causing blindness and death. In 1981, scientists discovered a new viral disease called AIDS, which has killed 32 million people worldwide. In 1918, viral influenza infected 500 million people worldwide. Influenza pandemics struck again in 1957 and 1968. In 2009, a flu virus called H1N1 or swine flu infected 1.4 billion people around the world. What causes a disease to become a pandemic? New diseases like COVID-19 tend to spread easily since our bodies don't have defenses against them. Some are much more contagious than others, and some are much more dangerous than others. Usually, a disease must be both very contagious and very dangerous to cause a pandemic. Not every dangerous or contagious disease becomes a pandemic. For example, the Ebola virus is deadly, but it is also fairly rare. There have been several terrible outbreaks of Ebola in Africa, but the disease has not spread worldwide. The common cold, on the other hand, is a very contagious disease, but it usually isn't deadly. Colds don't cause pandemics either. Today, we have much better medical help than people did during earlier pandemics. However, diseases can also spread more rapidly in our modern world than ever before. People live close together in cities around the world, and those cities are bigger than cities of the past. Sickness can spread easily in areas where people live and work close together. As humans inhabit more of the planet, we also come into closer contact with wildlife. As a result, it's easier for viruses in animals to infect humans. Travel can also spread disease. People can fly anywhere in the world in a matter of hours, sometimes bringing sickness with them. Detection. New diseases that might cause pandemics are often hard to spot at first. It takes time to understand how a new disease behaves. Doctors and nurses must be trained to watch for new diseases. In late 2019, a doctor named Li Wenliang raised the alarm in Wuhan, China, about a new disease that attacked the lungs. That disease turned out to be COVID-19. Sadly, Dr. Li died of the new disease himself just a few months later. As a new disease spreads, countries around the world must work together quickly to detect and stop it. The World Health Organization, WHO, helps countries communicate with each other so scientists around the world can share information. When scientists in one country figure out how to test people for a disease, other countries can use the same test. During the COVID-19 pandemic, Chinese scientists were able to identify the new virus very quickly. Those scientists gave information about the virus to the WHO. The WHO shared that information so scientists all over the world could start developing COVID-19 tests. Some countries were able to test large numbers of people right away, while others struggled. South Korea, for example, was well prepared for testing. When COVID-19 arrived, the South Korean government was able to test tens of thousands of people every day. Other countries, such as the United States, struggled to make enough tests for their large populations. A flaw in the first batch of tests U.S. personnel created made them useless. Delays in COVID-19 testing in the United States allowed the virus to spread invisibly for several months. This led to many more cases of the disease in the United States than in South Korea. Early testing helps governments control a disease. When a government is able to test large numbers of people, medical workers can act quickly to treat sick people and prevent them from spreading the illness to others. COVID-19 and the United States. Several issues in the United States contributed to the rapid spread of COVID-19 there. First, it chose to develop its own test rather than use the first test available, which came from a German lab. The first tests supplied by the U.S. government were faulty, however. This made it impossible to test people rapidly, and COVID-19 spread undetected through the population. Because many people had the disease by the time the tests were fixed, it became very difficult to produce enough tests for everyone. In addition, the United States, unlike some other countries, didn't have a social custom of mask wearing at the start of the pandemic. In many Asian countries, it's customary for sick people to wear a mask anytime they are in public. In countries such as Japan, China, and South Korea, most of the public began wearing masks as soon as COVID-19 arrived, which helped slow the spread of the virus early on. In the United States, however, the lack of mask wearing helped the virus spread. The United States also lacked a national strategy on school and business closures. Some states temporarily closed businesses and public spaces, a procedure known as a lockdown, while other states did not. The virus was able to spread more easily in states with less strict lockdown procedures. Containment. Containing a pandemic takes effort from everyone. During a pandemic, people must work together in every part of society to keep themselves and others safe. Governments, for example, must keep people from infecting one another. To do this, government officials might temporarily forbid travel. They might also temporarily close businesses and tell people to stay home. Sick people might need to quarantine or stay away from other people for a period of time. Governments might also make people quarantine before they enter a country so they don't spread illness. Officials also work with hospitals to track where the disease is spreading. Governments and hospitals work together to share the latest information about the disease so people can protect themselves. Doctors and nurses work hard to care for sick people during a pandemic. This work can be very dangerous. During the COVID-19 pandemic, some medical professionals caught the disease from patients, and some, like Dr. Li in China, died. Other workers, such as farmers, postal workers, grocery store clerks, firefighters, police officers, and school teachers, also continue working during a pandemic. These people, and many others who do important jobs, are considered essential workers, whose work helps keep society functioning for everyone. Citizens must also work together to keep each other safe during a pandemic. We can all protect each other by obeying public health orders, wearing masks, washing our hands often, and avoiding large gatherings. We may also need to avoid taking unnecessary trips away from home. Schools and offices may close. Our classes, jobs, and time with friends may move online. During a pandemic, people have to find new ways to connect with each other. During COVID-19, for example, people in Italy started a new daily routine. They came to the windows of their homes and sang together every afternoon. Governments and scientists must stay alert and continue to share information even after a pandemic appears to have passed. A very contagious disease can easily return. The work of controlling a pandemic often happens in cycles. The disease must be fought several times before it is finally defeated. Control. To control a pandemic, countries around the world work to slow, then stop the spread of disease. At the same time, hospitals continue to treat sick people, and scientists around the world race to discover a vaccine. A vaccine is a substance that makes people immune to a virus. A vaccinated person's body can fight off the disease without becoming sick. It usually takes scientists years to find an effective vaccine, test it, and make it available worldwide. The first vaccine was developed by Edward Jenner in 1796 to protect people against the deadly smallpox virus. Some viruses, however, like the virus that causes AIDS, have no known vaccine. For diseases like this, communities must work together to contain the virus so it does not spread through the whole population. The search for a COVID-19 vaccine is a global effort. In 2020, scientists in the United States, China, the United Kingdom, and Germany, among others, tested dozens of possible vaccines for COVID-19. It will take the best thinking of scientists all over the world to find a vaccine for this disease. Working together. Pandemics can strike at any time and spread with lightning speed as people travel, work, and live together. During a pandemic, everyone has a role to play in stopping the spread of disease. Whether it's a child staying home from school, a store clerk putting on a mask before work, a nurse helping a sick patient breathe, or a scientist studying vaccines in a lab, we can all do our part to keep each other safe and healthy. Connections. Writing. Research to learn more about another pandemic. Write an essay to compare and contrast the COVID-19 pandemic with the pandemic you research. Share your essay with a partner. Science. Research to learn more about how soaps are able to destroy or remove viruses. Create a presentation to share with your class.